Ng and to my fellow friends. Today I'm going to present Chemical Exposure Monitoring Report. By the way, my name is Su Ying and let's get started of my slideshow. So from the report that I read, the first step, the adequacy of the report. From what I read, the report are not quite sufficient, especially during the presentation of their slides, where they only shows one pie chart of pre-APF, and there's no comparison between the pre and post of APF. The usage of regulation they are using are not up to date for permissible exposure limit, or known as PEL, for benzene, toluene, xylene, and mercury. As for the technical sufficiency and comprehensive methodology, the scope work are too simple. They do not specific details on the job scope of each position. They only mention their work tasks, but not mention their roles. The sampling procedures are not sufficient enough. Needless to say, the sampling procedures are not up to date. And if you read the report, it is very simple, yet very not detailed when they talk about sampling procedure. So as for the result and finding for the calculation part, they only focuses on the assigned protection factor, which is called the APF, and they did not calculate for those that are not using the APF. And if you see the tabulated table, they only shows the time weightless average of 8 hours plus the PEL, and they do not include for MEL, which is inside the table in page 20 under results. So these are the examples of the result that I got it from the report. So the results are presented in a table form to show comparison. So like I said, MEL is called as maximum exposure limit, and TWA is called as time weight average. So if you see from the graph, it only shows two, which is the TWA for 8 hours and also for the PEL, permissible exposure limit. Okay, next I'm going to talk about discussion, recommendation, and conclusion. As for discussion, like I said, they only mentioned TWA 8 hours and PEL. They did not mention for maximum exposure limit. Their recommendation part, they did not mention the latest usage regulation. They did not recommend to send staff for further tests such as blood and urine tests to determine that the chemical are still, whether or not they are still exist in their body. As for the conclusion of the report, the objective, although is achieved, but the data are not completed and sent to the assessor to assess and to give suggestion. But good thing about this company, they do yearly assessment, which is part of the requirement. So how do I improve this assessment if I were them? Always look out for new updates on CHRI guidelines. I suggest that they follow these steps, which is include number one, the systemic approach, which help to assess, and they also should be conducted in a systematic way, following a step-by-step process. This will help and ensure that all important factors are considered and that assessment is comprehensive. Number two, involve all stakeholders. The assessment should involve all stakeholders who are affected by the use of chemicals in the workplace, including employers, managers, and safety professionals. This will help to ensure that the assessment is accurate and the recommendations are implemented effectively. Number three, use the latest information. Like I say, assessment should be based on the latest information, such as hazard chemicals, which include the safety data sheet. This will help to ensure that the assessment is up to date and the recommendations are effective. Then next we move on to the next suggestion I will consider is the consider full range of risks, whereby the assessment should be considered full range of risks associated with the use of chemicals, including acute hazard, chronic hazard, and cancer risk. This will help to ensure that all potential risks are identified and that appropriate control measures are implemented. Make recommendation for control measure. The assessment should make recommendation for control measure to reduce the risk associated with the use of chemicals. This measure should be feasible, effective, and cost-effective. And always review and update assessment regularly. The assessment should be reviewed and updated regularly to ensure that it remains accurate and up-to-date. This will help to ensure that the risks associated with the use of chemicals are continuously managed well. The next recommendation I will ask them to use is to look out for the latest guidelines for permissible exposure limit, especially for these 4 chemicals in benzene, toluene, mercury, and xylene. If you see from here, benzene they have reduced it from 5 ppm to 1 ppm, average over an 8-hour work shift and 5 ppm, not to be exceeded during any 15-minute work period. Toluene, 50 ppm average over an 8-hour work shift and 100 ppm not to be exceeded during any 15 minutes of work period. Whereby for mercury is 0.1 mg average over an 8-hour work shift and 0.5 mg not to be exceeded during any 15 minutes of work period. Last but not least, xylene, 100 ppm average over an 8-hour work shift and 150 ppm not to be exceeded during any 15 minutes of work period. As I say, the sampling procedure are not detailed explained in the report. They should have included the step-by-step procedure, which is they should have written what is the preparation, what is the necessary materials they should include, and what is the latest safety data sheet of each chemical in interest, and select the appropriate sampling for each method for each chemical, and prepare the sampling equipment according to the manufacturer instruction. Number 2 is sampling. They must follow the steps on how to collect samples. It must be well-ventilated area. It must be using the pumps to draw air into the sampling tubes and collect the sample for the correct time, and also label of each sample with date, time, and location of it. Number 3 is analysis. We must always ensure that the sample should be sent to a proper laboratory for analyzing, which include these 3 things, which is a gas chromatography, mass spectrometry, and atomic absorption spectroscopy. Number 4 is result. So every time when we send samples to the lab will provide us the result, and also they will include the concentration of each chemical in a sample, and also they will include the uncertainty of the result. Number 5, interpretation of the result. The result of analysis should be interpreted in the context of permissible exposure limits of each chemical. If the concentration of chemical in the sample exceeds, then further action may be required. This may include implementing additional control measures, providing medical surveillance to employees who are exposed to the chemical. And it's important to follow correct sampling procedure when sampling for mercury, benzene, toluene, and xylene. This will ensure the result of analysis are accurate and reliable. So here are some additional tips for sampling of this chemical. Like I say, use the correct sample, collect the sample in a well-ventilated area, label each sample, send a sample for a reputable laboratory for analysis, and number 5, interpret the result in the context for PEL. By following these tips, you can ensure that sampling procedure is conducted correctly and that the result of analysis are accurate and reliable. And last but not least, I will recommend that everyone should follow the latest usage regulation for better guidelines. Why I do say so? If you see from here, the latest regulation in the year 2020, they have study on benzene, which have been reduced from 5 ppm to 1 ppm. New chemical has been discovered, has been included, which is a methylene chloride that has been added into Schedule 1. The list of chemicals in Schedule 2 that has been updated. Requirement of medical surveillance have been extended to include more chemicals. Training requirements for employees have been enhanced, and chemical management committee have been established for each industry. So the latest usage regulation is a significant improvement over the previous years. It provides employers for more detailed guidance on how to manage the risks associated with chemicals in workplace. It also provides employees with greater protection from the hazard of chemicals. If you, an employer or employee who is exposed to chemicals in the workplace, it is important to familiarize yourself with the latest usage regulation. You can find more information and regulation on this regulation at DOSH of each of the country. Remember, safety of the employee and the guidelines are very, very important. Do keep updated to protect employee and all of us. Thank you.